fact, we can conduct the business of REMSCO unlike the previous meeting. So thank you for coming. Marie, roll call, are we ready?
Ready.
Okay.
This is the Regional EMS Council of New York City, November 27th, 2018. Dove Jacob,
Present.
Ari Weiss, Christopher Bills, James Booth, Christine Mazzola,
Present.
Bradley Kaufman, Patrick Myers, Allison Burke, Dominic Battinelli, William Goffin,
Here.
Joseph Marcelino,
Present.
Daniel Mizels, Mordecai Goldfeder, Robert Bristol,
Present.
Daniel Rodriguez, John Johnstone, Martin Grillo, James Downey,
Present.
Louis Deutsch, Joseph Schenker,
I'm here.
David Benelli,
He's not here.
thank you, Scott Orlansky,
Present.
Mordecai Lax.
Present.
See, they shouldn't be sitting all together.
It's safer this way.
We should separate them,
For who?
Yeah,
like in school. You sit there, you sit there.
Vincent Baranco,
You'd be surprised to know that these guys actually do control.
Scott
It'd be
Chang,
dangerous if I wasn't.
person.
Arthur Cooper,
Here.
Brian Levinsky,
Present.
Manfred Fuchs,
Here.
Sean Graves,
Here.
Yedidia Langsom,
Present.
Dennis Laurie,
Present.
Mitchell Powell,
Present.
Jerry Gumbo,
Yep.
and we have a quorum.
Thank you very much. Okay, the first item on the agenda is the approval of the June 26, 2018 minutes, because the October 23rd meeting did not meet and there was no quorum. If you can remember back to June 26, I assume you've all reviewed the minutes. Are there any comments or corrections or discussion on the minutes?
Motion.
Motion to approve?
Second.
Okay, all in favor? Anyone opposed? Any abstentions? Mark it please as unanimous. I do note one thing on the minutes is that it reports that the Edras Nashim organization was given a 90-day extension starting in May. I believe 90 days are up, so I've asked Marie to send them a letter that should they want to pursue this further, they need a new application. Okay. The next item on the agenda is the correspondence report. Okay, I assume this is the October, is this one, or this is the last one?
This, yeah, that's the only correspondence report, the one from the last meeting.
Okay, so Finney's replacing Chief Christopher Bills with Chief Denora Claudio, and District 18 has appointed Gerald Gelbart as an alternate to Louis Deutsch. Thank you. Okay, and we need to now approve those. All in favor, say aye.
Aye.
Anyone opposed? Any abstentions? Please mark it unanimous. Thank you. Okay. There was a memo sent to Ross Dowling 911 unit requesting information to clarify how paper PCERs are accepted and rejected. A meeting was held, not is being held, but was held at November 5th at Metrotech with New York State DOH representative present, and I believe it was a conference call. I was on the phone call, I believe.
No, actually, this was an in-person
Yeah, but
call.
I think there was also other people there also. I was on the call. No, maybe I was, maybe I'm dreaming. In any event, what was the result
This is your
of
dream.
that meeting?
This is still a dream.
Don't worry.
The outcome of that meeting is that we're going to put together an information package for our volunteer ambulance corps to clarify how to complete and submit their PCRs, so that we don't have the issues anymore of non-compliance with submission.
Thank you. I think there was callers in that phone call.
Not for that one, probably was another one.
Another one, okay. Anyway, We have to read into the record notice from the Department of Health. Melvin Harrington, EMT 128466, $1,000 civil penalty for violation of 800.15B. County of Residence Andes, I have no idea where that is in the state. Anybody have any idea that there's a county called Andes somewhere
There
in
is
the
no
state?
county in New York State.
Well, that's what it says here, so,
But that's what I got from the Department of Health.
okay,
I'll clear it up.
It's written on the
Whatever.
internet, it must be true.
okay. Okay, the New York State Department of Health yelled at us, okay, for a late submission of student applications for CLI, and the council responded to their yelling at us, okay. We received a copy of Instacare LLC doing business as Midwood Ambulance Certificate. DOH 1019 expires in, I hope not in 2002, in the year 202.
A long time ago.
So it's in 2020.
In 2020. Okay, we're doing fine. The following course sponsors submitted renewal forms late. Fidney, Modern Health Resources, West Queens EMT Institute, and Training Institute of Medical Emergency and Rescue, and I assume they will approve.
Yes, they do.
Good for them. We sent out agendas. We asked for at-large nominations, which we will discuss in a moment. A nominating committee report was sent out to REMSCO members. We sent a letter of support for Coney Island Hospital PCI. We sent a letter to Ryan Greenberg, new director of New York State DOH EMS, asking him to reconsider the revocation of several VAC certificates. I'm not sure that we've gotten a response,
We
Other
received a
than
verbal
saying-
response.
we're saying no.
Yeah.
And if any of these agencies want to appeal, they'll go through an appeal process. Okay, we sent out an email for a proposed to a new unit, Care Unit 911, as a new EMS rated agency in Far Rockaway, and we told them how to apply for a CON. I understand we heard nothing back. And we sent a letter to the PAPD asking for the status of their ambulance certificate. Have we heard back?
Their certificate was surrendered, correct? The Port Authority certificate.
And I guess that is their status. Okay, we sent a thank you letter to Fidney for collaboration on stroke education materials. This was very helpful, and we may hear some more of that from the Training Education Committee. We had sent out an invitation to join, I assume this is the what is this? stand for?
It's Presto.
Presto MSU
Yeah.
for involvement in the pre-hospital stroke treatment. We sent out an email to Gene Taylor regarding the use of instructors at Bed-Stuy VAC. And we sent out EMS award nominations to Andrew Johnson, and these include Megan Farley, EMS for EMS Nurse of the Year, EMS Agency of the Year to Park Slope, and most importantly of all, EMS Leadership Award, Nancy Benedetto, which they actually issued the award.
Yes.
And if you were here at the meeting that wasn't, we had our beautiful plaque displayed. It says here, please see her award, which is on display, but you need to do some time traveling back to the meeting that wasn't. But it was a truly nice plaque,
202.
okay?
18
And
minutes, okay.
maybe take a picture of it and send it out,
Okay.
okay?
And
Others,
Megan Farley also got the award.
and Megan Farley got the awards for EMS Nurse of the Year. We also sent out EMS Educator of Excellence to Gail Larkin, Physician of Excellence to Paul Barbara, and Excellence in EMS Quality and Safety to Michael Redlener. So, thank you for your nominations, and that worked well. Okay, that takes care of the correspondence report. The next item on the agenda is the election of officers and at-large members. We'll start with the at-large members, and then we'll proceed to the election of officers. You've all received a nominating report. There are 4 names that were recommended for appointment. These are Dr. Robert Krupe, MD, Megan Farley, RN, Michael Vach, EMTP, and Martina Bassarella, EMT. There are 3 seats available, and therefore we must have an election, which we will do in a moment. Marie, you wanted to comment on the importance of having certain representatives on REMSCO?
Something for the council to consider. We really need another physician, and we have no RNs on the council. So vote as you would like, but consider that there are 4 people. One of them's a physician, one is a nurse, and the other 2 are EMPs and EMTPs.
Okay, we're going to distribute the ballot.
How many open seats are there?
3.
There are 3 seats, there are 4 people.
There was just as a point of information, there was a letter that was sent out by the nominating committee that reflected that there was 4 seats.
Yes, that's why we're correcting it
And that was an
tonight.
error.
Okay, that's an error.
Yeah,
That was an error.
and it was my error. I counted, and I thought there were 4 seats, and then I realized that a name disappeared off my membership list. I reinserted it, and so I'm correcting it tonight, and I apologize.
If anybody wants my seat.
So please,
No.
please take a single ballot only, and please vote for 3 out of the 4, at least, no more than 3 out of the 4. A ballot that has 4 votes on it will be discarded.
These are numbered too, so,
Oh, someone can check up on you. Do I get
well,
one?
I don't know which numbers you're getting.
Okay. Do I get one too?
Yes,
Can I have one? No, I have one already. Or is this number 4, or this is for your notes?
that's.
Is this
you
number
can have
6 or 9?
Okay, I got one. Pass
Is
the number.
this 6 or 9?
It's an R.
I'm playing with a full deck, so it doesn't matter. So, Marie, wasn't it 3 at-large seats and 1 physician seat?
That's what I thought. That's what
Just to let you know, only the primary member can vote, or if you're the alternate and your primary is not here, you vote, so only.
So, if I recall, at the nominating committee meeting, there were 3 at-large seats and 1 physician seat.
No.
So
That's
I-
REMAC. You're mixing up REMAC with REMSCO.
So where did we lose the seat?
Huh?
We lost the seat because I counted incorrectly,
Oh.
Where's the,
sorry.
Which, can we
no, where's the
identify
signage
what
sheet?
seats were involved, what turned out, what section?
These are at-large seats.
These are at-large seats.
They're all at-large.
They don't belong to anybody.
Yeah,
Right.
I mean, we don't vote on
I was
organizations.
looking for the mix.
Right. Yeah, no. Okay, so vote for no more than 3 individuals.
And then we'll have somebody else count, because staff should not be, okay, you're the trustworthy staff, I'm not.
Yeah, that's.
I'm not trustworthy. Leftovers, thank you. Thank you very much.
Okay, we're going to pause now while they count, because we need to then, depending on who is elected.
Trustworthy?
I don't know, Nancy, you want a blank one? Yes. I want to be trustworthy first.
These votes,
Number 27, step up.
Mary Ann doesn't know who any of you are, so she'll do it. Did you collect? Mary Ann and I will do it.
I agree.
we're gonna wait for you,
Why?
because we need to then vote, move on to nominating officers. We can't do that until we know who.
All right, we'll do this quick.
So everyone take a deep breath and talk to each other for a while and be friendly.
Pretend you like each other.
Right.
There's coffee left.
Should've bought some grapes over here.
We're gonna get into
Right.
Part 1 or part 2?
Food fight.
What do you call it, Keurig or something?
So everybody has.
Joe had a peel on that.
I want to do it.
She was doing it. That's what he's using.
Working on my search. You know, this isn't a number.
Madam Miller, or?
Did everyone get a chance to sign the attendance sheet? It's up here if you need it.
Take her, listen to it later. Don't say it up in the council.
So I think it just helps with the whole time. Oh, so you get to, you didn't go business, that's like.
You have to have an hour and a half to waste today. I think you'll see what.
Oh, the mutual aid. No, that's internal if you want mutual aid.
Here's your house.
Life is, you gotta always go into the order, but I don't know.
I said stop right there.
It's like, is that? The building was sick of our
Remember, it's Florida, so recounting 10 times.
We're gonna find ballots in the closet, so a week from now, well, we gotta do a recount.
We're sending Nancy and Mary Ann to Florida to help with their counting.
We found all these ballots in this closet. They were definitely mailed.
Al Gore is president.
Yeah.
Again?
Bunch of ballots full of Ross Ross.
Okay.
Yes, should announce them now because then we have to.
Okay, so, folks, we're back on. And the results are? Okay. Dr. Robert Krupe, 18.
Yay.
Congratulations.
Okay. Megan Farley, 14. Martina Bassarella, 14. And Michael Vatch, 11. So, Dr. Krupe, Megan Farley, and Martina Barcelona are now elected to at-large members. We now proceed.
Congratulations.
And you three had better show up at REMSCO meetings to help make the
Why are
quorum.
you looking at me?
Why are you looking at me? I have to come to every meeting. Why are you looking at me?
They're on this side of the room.
I'm not sitting
They're
here.
over there.
Remember,
Okay,
He's dreaming
You
again.
get it, they're on the links.
This is his dream, that's a scared dream.
now we need to have a first vice chair. And the nominating committee has recommended Dr. Robert Krupe as first vice chair. Also, he was, as you know, Dr. Krupe has been sent to REMSCO as our representative to REMSCO, and I will take the seat, the alternate seat. Okay, so, I guess we need to vote. All in favor of Dr. Krupe as first vice chair, please say aye, or raise your hands.
Aye.
Is there anyone opposed? Any abstentions?
Dr. Krupe didn't
I was
oppose.
gonna wait.
This is not a football game or whatever it is. Dr. Krupe, congratulations. Okay. The officer's terms are for 2 years, ending June 30th, 2020.
Jojo's pretty damn good.
Okay. Thank you. And you can take that. Okay. We now move to the staff report, emergency preparedness update.
Okay, so we gave the report at the ambulance committee. I will briefly repeat and summarize. So the main item in the report is in regards to the 2019 New York City Surge exercise. It's a functional exercise being operated by the New York City Department of Health, looking at a regional evacuation of hospitals, how they would decompress their facilities, identify patients for evacuation, connect those patients to towels, do bed matching, and set up transport. During last year's exercise, they focused mostly on the in-hospital piece of that. During this year, there is a significant transportation component to it. Now, we're not moving any patients, obviously, because that would be a nightmare and very costly. However, we are utilizing this drill to try to identify what the stress limits of our regional EMS system is for doing evacuations. So our private ambulance companies will be key participants in the exercise this year. We will be asking each of them to have a representative participate and play in the drill to receive the hospital request for transportation. The hospitals will be notionalizing that they'll be activating their contracts and calling the transportation providers with whom they have contracts with to do the evacuations. We'll be asking on the ambulance side for agencies to take those calls, log them, see if we can quickly log those requests, see if the hospitals are giving us accurate towel levels, and to see what sort of stresses that puts on our resources. At what point will it become evident that our regional resources would not be able to handle a full evacuation? So we're looking to get some very valuable data on that. We know post-evacuation's been a big thing in this city for quite a few years now. We've always known that we would need to activate mutual aid and to activate the HEC in order to facilitate the successful evacuation of all of our healthcare facilities, but we've never been able to identify exactly what that threshold is. We're hoping this drill will help to start to make that a clearer picture. In addition, we're going to be collecting some data on resource availability, how quickly agencies can make resources available, given 0 notice, given 8 hours notice, and given 24 hours notice. And what sort of resources could you free up to help with some sort of regional event, whether it's evacuation or even a mutual aid request. So we'll be sending out we're going to be sending out multiple notices. This is primarily going to go out to This is primarily going to go out to our private ambulance services. The data that we collect, we're going to be aggregating it to put together a regional report. So this is not going to be anything that's going to be agency specific, that's going to come to the council, but it's going to give us a regional picture that we're looking to get. And that's going to help us in our planning with the transportation branch and with the HEC and things of that nature. So just be on the lookout, we're going to be sending out additional notices on that. In addition, we're still participating heavily in the city's RX-STAT committee and regarding opioid overdoses. We are still distributing naloxone, and we are now distributing leave-behind kits. So any agency that needs either naloxone to utilize for their patient treatment or would like to participate in the leave-behind kit program. In this program, you would be able to leave behind a kit that has naloxone and instructions for its use. to either the patient, should they refuse transport, or even to the patient's family or friends or anybody that wishes to have it, should you transport the patient. So I think ambulance, I misspoke, I said it was only for treat and release. You can leave the kit behind, you do not have to leave it with the patient, you can leave it with a family member. So you get some poor kid, overdoses, the mom says, what do I do the next time? You can give her the kit, give her a way to help her child. So just contact our office if you're interested in that, and we are providing those kits. On the EPCR front, the state is continuing its transition to NEMSIS 3 data. If you have not already done so, you should be speaking with your EPCR vendor to start that process for your agency. It does take a little while. It does take a little while to do the transition, and especially on the training front for your members, NEMSIS 3 data has a lot more data points than NEMSIS 2. It's going to take your providers a little while to get used to all the extra data points they're going to have to fill in. The state, in their new schematron, has also put in a lot higher standards in terms of the PCRs they will accept. So many of the items that used to just lower your validity score will now cause the PCR to be rejected. So training up your members on filling out these reports using the NEMSIS 3 data is going to have to be a key focus for your agency. We received EPCR applications from 2 agencies, NYU Langone, to upgrade to NEMSIS 3 data, and Senior Care EMS, who is changing their EPCR vendor, and that comes before the committee to approve for regional endorsement. So both of those applications were reviewed by staff, and they are both complete.
Motion to accept.
Motion to accept, is there a second?
Second.
Is there any discussion on this? All in favor, say aye. Anyone opposed? Any abstentions? Motion carries unanimously. I have a question. There was some talk that the region is going to renegotiate for a new EPCR vendor down region?
Yes, and that is still ongoing.
That's still on. Nothing has been made, no decisions have been made.
No, we haven't made any final decisions on that. Currently, we are working with the agencies that are on our current system to get their legacy data up into the new NEMSIS 3 bridge. So our agencies that were on our regional system were utilizing NEMSIS 3 data way before everybody else. So we started 2 years ago, and now the state's finally ready to accept their past EPCR data. We're doing that. That's our focus right now.
Thank you very much. Nancy, is there a program agency update?
There is,
Okay.
which I have not had to give in quite some time, so I'm sorry to say that I have to give it now. No. Basically, many years ago, we always had issues regarding our program agency payment for vouchers. And so right now, we are in the midst of that same situation. A lot has to do with new people up at Albany, vetting processes that go on in terms of approvals for the new folks. And the finance person left, the person who approves the voucher left. They've all gone in different directions within the bureau. So right now, I'm working with new people who are learning their jobs as well. So our September voucher has not yet been approved or received. We have not received any money yet. I'm willing to accept donations tonight if we do that. So we've not had that issue for a while, but but it was my obligation to tell you that we are way behind in receiving any kind of funds from the state. And I hope it will get resolved soon.
Interestingly, I got my reimbursement already, which is much sooner than usual.
Well, there you are.
It usually takes several months
And that reimbursement was for what?
for the meeting,
For
last meeting.
September. Oh, well, that's
Usually
very
takes
good.
them much more before they send it out.
Yeah, well,
Whatever.
different people.
It's not big money anyway.
Yeah, that's the
Okay.
difference. Thank you.
Thank you very much. Ambulance Committee report.
The ambulance committee met immediately prior to the REMSCO meeting this evening. There was no review of new applications for determination of need, nor there was no review for transfer of operating authority. The most critical component was, in regards to the meeting, was the ambulance mapping for the volunteer ambulances. It's still being in discussion also with the OEM, and goes with the other agencies. And that pretty much concludes the ambulance committee report.
Are there any questions for the ambulance committee? Hearing none, we move on. Training and Education Committee report.
So Training and Education Committee met on October, well, actually met twice, we met in August and on October 29th, but I'll give a summary of the two. So we hosted Kingsborough hosted us for a CLI class in the summer, over the summer, which was successful. We changed the curriculum for that, and that's going to become our model moving forward. We're in the process of finalizing the new curriculum for a CIC class that we hope to run in the first quarter of next year. We are also, no, we're not working on developing an instructor update. We had an instructor update on the 18th of this month, which was also successful. It was broken down into 3 modules by request of the Department of Health, to 3 3-hour modules, which can be used for various things by the instructors that needed it. Our goal in the next year is to run at least 2 of those a year. For the other instructor classes, our hope is to run, it's going to be based somewhat on need, but at least 2 of each, 2 CIC and 2 CLI. There's a big deficit of both, so core sponsors need them. At the last instructor update class, I also presented the stroke training. I demoed it over there, so we had some discussion on it. I explained to the instructors what the goals of the training are, and it's basically video-based, and how it's going to be used, and the fact that for the most part for them it's going to be hands-off. The only component that's going to be done by them is going to be the hands-on part. Everything else, didactic, teaching the new protocol and how to utilize the new assessment tool, is going to be on REMSCO's LMS. So speaking of the LMS, message went out recently trying to drive people more towards the LMS. We're also looking into a constant contact account to, I guess, promote a little bit more brand recognition. As we all know, I think those of us that are paramedics know that you need to know about REMAC and REMSCO. You don't really have a choice, but a lot of EMTs, especially the new ones, have no idea that it exists. Most of them do not know, so we want to be a resource for them, not just from the training and ed side, but in general. So we're looking into a means for getting information out to them that will also pull them to the website. Looking to push some updates out on the website as well. One of the updates that was discussed was adding some tabs for different either training areas, enhancing protocol areas, adding a list of links to email addresses for chairs so people can communicate directly with chairs of departments if they're looking for information. So I'll leave that at that. One of the things we did at the instructor update class also was a stop the bleed, train the trainer. That's something that we're looking to promote more in the region, especially since the protocol came out in the last half year or so, sometime in the last year,
6 months,
whatever,
yeah.
for hemostatic agents. In terms of succession planning, so there is still a shortage of senior instructors, regional faculty, and PCs who are able to run instructor level classes. So we have been submitting names to the Department of Health, hoping that they move some people up to regional faculty who will eventually be able to move up to PC, who will be able to run instructor level classes to make more instructors for the region so that we can keep doing what we're doing here. We want to push out a quarterly newsletter, so as soon as the constant contact account is up and running, we're going to be doing that. And regarding the stroke training, again, Chief Mazzella, if you can relay my thanks to the Bureau of Training. It was a really great collaborative project. A lot was put into that on both sides. The videos came out great, and I think that that's going to probably be our first really good example of how standardized training throughout the region will look moving forward, and hopefully that rolls out successfully. We're looking to run another instructor class, I believe a CLI class, and a CIC class at the beginning of the next year. That's,
And we'd like to do another instructor update by
Right,
January.
so
That's really-
we'd like to, yeah. The only 2 things remaining are the protocol update itself, that's going to be coming out within the week, I believe. And so Training and Ed is going to be putting together a package for that. Again, people can go straight to the LMS, so if they work for 2 agencies, 3 agencies, all they have to do is go to REMSCO's LMS, get it done, and they can take that certificate to any of their multiple agencies. It kind of takes that onus off the agencies to a certain extent, and the information will be a lot more standardized, and people get the same information across the board. Other than that, our next mission is going to be collaborating with CNC on CME approval, and that is all we have.
Are there any questions for the Training and Education Committee? I just want to point out that the Training and Education Committee has been incredibly productive over the last few months. And thank you very much for your leadership and for what you're doing for the council. We appreciate it. Okay, Dr. Schenker, Regional Emergency Medical Advisory Committee report.
So I have a lot of reports, so
I'm sure, let's start with that one.
we're gonna start with this one.
I'll mention
Actually,
your name
these two.
twice, don't worry, go ahead.
No, you don't. Okay, so let's start with October.
Excellent report.
So, actually, we met on September 4th and October 9th, and the following is a summary of that meeting. So I didn't know this was coming up, but I guess I should bring it up now. The current officers were recommended for reappointment. That includes myself as chair, Jeffrey Ravitch as first vice chair, and Bradley Kaufman as second vice chair. And apparently this requires your all approval, so
That's right.
Again, that's right.
do you want to do that now?
Yes.
All right, let's do
Okay,
it.
is there any discussion
Because if we
on
vote you out, then you can't read the report anymore.
That's a
those
great point.
individuals?
And I don't have to come.
Someone might talk about you. Anyone have anything nice to say about Dr. Schenker?
Oh,
I hope not.
Okay.
see
All in
what you
favor,
guys next time.
say aye.
Uh,
Anyone opposed? Any abstentions? Please mark it as unanimous. Thank you. Continue.
Okay, the following enforcement actions were read into the minutes then. I don't know if they have to be read in here, but I'm gonna do it anyway. Stanford Smith EMT number 168165 is forever prohibited from participating in a CME-based refresher program in violation of 800.16A7, and he resides in Brookhaven County. The NYPD ESU tactical protocols were approved by CMAC REMSCO. The NYP MSTU program gave a presentation about a cerebral oximeter that they're gonna be, that they would like to add to use on the ambulance as a monitoring device. It's an FDA-approved device, there's no change to current protocols, so that was approved, and a letter will be sent by REMAC to the Department of Health.